What do we call our loved ones? We call them honey, sugar, cupcake, sweetie. Too much sweet, isn't it? That's what we are here to talk about. Diabetes in pregnancy. Hi, I'm Dr. Prathima A, consultant obstetrician and gynecologist at Motherhood Hospitals, Banshankari. So, what is diabetes in pregnancy? Sometimes women in pregnancy lose the control of maintaining their sugar balance in pregnancy. That is what we call diabetes, which comes during pregnancy. Usually it comes somewhere in the middle of pregnancy and it usually goes away once the baby is born. But there are also women who already have diabetes and are entering the journey of pregnancy. So these are the basic two types of diabetes which we see in pregnant women, and both of them, it is very important to diagnose them, treat them, and keep the sugar levels as normal as possible for you to have a safe and healthy pregnancy. So why are we so worried about diabetes in pregnancy? What can it cause? So it can cause the babies to become too big. So too big the baby becomes, it can't come down easily. So the deliveries might be more difficult. The water level around the baby can increase too much. So that can cause premature deliveries or premature leaking from the membrane. Then there is a metabolic pathway that is set inside the babies in mothers whose sugars remain very high. So the children of these women who are diabetic in pregnancy may face issues like childhood obesity. They might themselves become diabetic, hypertensive, and at increased risk of heart issues when they are young adults. The other things which these cause are diabetes decreases your immunity, so you can be prone to a lot of infections in pregnancies. And babies can be born with a little premature lung, so it might need some time in the NICU. So now we know what all it can cause. So how is it diagnosed? So we diagnose diabetes in pregnancy with a simple blood test. We ask you to drink up a very sugary solution and we take your blood levels 2 hours from it, and that levels will diagnose the diabetes. So what do we do? How do we treat it? Diabetes is managed as a multi-speciality management. So there's your obstetrician, there is an endocrinologist, there is a dietitian who all get together and manage your diabetes. So the basic things are to make sure that your diet is well controlled, you stay active, you're physically active and doing some exercises, and sometimes you might need some medications or insulin to get your sugar levels normal. It is not very scary. I mean, I'm sure it is scary that you become diabetic in pregnancy, but it is more important to manage it carefully. We need to monitor your sugars regularly, make sure your diabetes is well under control so you can have as normal as possible pregnancy, as safe as possible delivery, and a happy journey going forwards. Thank you.